Next, we're going to talk about mucolytics, also called expectorants. You might see them referred either way. Whenever you see lysis or lytic, it means that something is being broken up. So mucolytics is talking about something that breaks up mucus and thins it out so that you can expectorate it, or, basically spit it. So an expectorant helps you expel excess mucus from the lungs. Often, if you've got a cough, it's a productive cough, one where you can bring up excess mucus, and an expectorant will help that process be even more effective. So on page 121 in the textbook, we talk about expectorants or mucolytics. Let me turn there my own self. All right. We're going to be talking about meds that help during a cough, whether it's first a wet cough and then a dry cough. So what an expectorant will do is to decrease the viscosity, the thickness of mucus in the nasal passages. And what they think, the scientists who've developed that, it seems to draw in fluid into the respiratory tract. And that helps thin the mucus and helps a person cough it up. So when somebody's going to use an expectorant when they have what's known as a productive cough or a wet cough. So if you've had asthma attacks, you've had pneumonia, maybe an upper respiratory infection that's gone into bronchitis, and you just feel like your lungs are just clogged, an expectorant will help pull in some fluid, thin it out so that you can cough these secretions up. The main expectorant that's on the market is a drug called guaifenesin. You'll see that mixed with a lot of cough medications and sold by itself. And like we said, drinking 2 quarts/liters of water or other fluids. All the respiratory drugs can be helped by forcing fluids, whether it's a decongestant, whether it's corticosteroids. Try to keep your fluid intake high, especially if you're acutely ill, including a fever. Fluids always help. Now, the only extended release guaifenesin is called Mucinex, and that is approved to last. They have these 12-hour preparations. They're higher dosages, and the FDA has said that that is safe. Now there's some generic forms too, but it's all guaifenesin. With expectorants, you're going to just help make coughing easier because it pulls fluids into the respiratory tract. Many times they pull them from other tissues, so you can get constipated if you use it quite a bit because it's pulling your body fluids from the GI tract that would ordinarily go to the GI tract to the respiratory tract. It's said don't use guaifenesin for children under 2. An overdose can be possibly dangerous, and that's true with everything. Sometimes people complain that guaifenesin can cause nausea, so you might want to tell people to take it on with a meal. Antitussives. A tussive, something, with the word tuss in it, is referring to coughing. So antitussives are going to be drugs that are effective against a cough. There are 3 reasons that people might cough, or 3 ways that antitussives work. One way they work is to depress the cough center in the brain, and we do have an area of the brain that responds to any kind of irritation in the nasal or oral passages and create a cough. Very important reflex to help us get rid of any kind of a foreign object. And that's one of the things that opioid overdoses do, is depress the cough center in the brain, so the person doesn't realize that they have to cough and deep breathe and sit up and try to clear their respiratory passages. They also work to calm down the reaction of stretch receptors in the respiratory tract. When we take in a foreign object or our throat or nasal or oral passages are irritated, we're going to react by coughing, sneezing, clearing our throat, trying to get rid of the irritation. And some antitussives just soothe areas in the throat that are irritated from inflammation. So the main use for antitussives is to relieve a non-productive cough, what we call a dry cough. Sometimes, especially if you have recovered from an illness, you'll have a cough that doesn't bring anything up. It just makes you cough without giving you any kind of a result. So it's very exhausting. The main non-opioid antitussive is a medication called dextromethorphan, which we have previously referred to in other chapters. Remember, the elderly on a lot of mental health drugs are not supposed to take dextromethorphan. Doesn't work well. Robitussin is the trade name for that. Many times, especially with chronic conditions, opioids, such as codeine or hydrocodone, will be ordered. I've seen COPD patients on hydrocodone, especially liquid hydrocodone, for that dry, irritating cough that does nothing but just exhaust people. Table 7.6 on page 121 discusses both opioid and non-opioid medications. Because some of these drugs are opioids, they're going to cause constipation, they're going to make you sleepy, your mouth will be dry, and you can get postural hypotension. Opioids can potentiate other central nervous system depressants, and sometimes they can increase the effect of aspirin, which can be a good thing. You can pop an aspirin along with your opioid and you kind of get an increased analgesic effect. Make sure you read the nursing process for the patient's history. You want to make sure that they don't already have a history of COPD or asthma, because if you have COPD or asthma, many times you do have a productive cough and you want to cough. The only cough you're trying to get rid of is if it's a COPD patient with a dry cough or a persistent cough where they can't rest or eat. And in that case, an antitussive can help. But if they've got mucus in their bronchial passages, that needs to come up. It needs to be thinned out and brought up. And of course, there is a possibility of getting addicted to codeine or hydrocodone, and we have to make sure that our patients are aware of that. Using caution with other CNS depressants. Watch for the abuse of dextromethorphan. A lot of teenagers many times will get a hold of Robitussin because there's nothing else in the medicine chest. So taking large doses of dextromethorphan has been shown to be somewhat common, especially with teens who can't get their hands on everything else. It's called robotripping, and it can be really dangerous. A couple of kids have died from just taking too much. So you'll notice now if you go shopping for cough medicines, they're going to ask for your ID. Page 122 has patient and family teaching, and just remember those side effects of constipation and orthostatic hypotension. That is it. You can stop here if you've heard the whole lecture. If you didn't get to hear the front part, then I will go back and redo the first part of the lecture up to the nasal steroid part.